Hi, everybody. I'm here just for a technical announcement. There will be a photo of the group photograph just at the end of the speech of Pedro. And if it is not raining, we are going to take this picture outside. If it will be raining, we take just in this room, okay, the photograph. So don't move before the photograph, okay? And then come back for the General Assembly. For those who may want to leave before the General Assembly, we have organized a bus in front of just outside here. But we kindly ask you to stay for the General Assembly. I'm not credible. So for the Diamante pickup, tonight we are going to Diamante, to the sea coast, and the pickup at your hotel will be at 5:30. Okay, so at 5:30, buses will pick you up, and we will go to Diamante. And for tomorrow morning, the bus line is at 8:45, like this morning, okay, to arrive here. Okay, thank you. Please, Gilbert. I have one. Thank you. I have one more thing. I have kindly asked you to wear the mask in this room. Okay. Thank you very much. Yes.
Okay, it's my great honor to welcome our second plenary speaker of the conference, Pedro Carneiro. He's a professor of economics at UCL and a research fellow at IFS. Pedro received his PhD at the University of Chicago. He's on the editorial board of many journals. He works in many areas of applied micro, and I think the ones that are really outstanding in terms of the contributions he's made are on human capital formation, skill formation, education, child development, welfare programs, intergenerational mobility, an area I care a lot about, evidence of credit constraints for higher education, and one of my favorites, the heterogeneous treatment effects of, in causal evaluation. So Pedro's done fantastic work. We're really excited to have him here. Today he will be talking about the free provision of daycare, another very interesting topic. So without further ado, please welcome Pedro Carneiro today. Give us plenty of talk. Thank you.
He's going to put it up. It's really a great honor to be here with you, and it's been also really pleasant. Some great papers, and saw some old collaborators and you, and some wonderful friends. And so today I'm going to talk about human capital formation. It's a topic I've been working on for a long time, as Wilbert is saying. It's with a focus on the early years, actually. But a lot of what happens that's important for kids goes on in the family, of course. And here we're going to talk about a little bit interaction of a provision of a public program and what goes on in the family. What should I do? Oh, it's for him. Yeah, don't worry about it. Oh, make it small. You present. Sorry. Okay, sorry. Okay, so So main question for today, it's about public provision of daycare. And usually these public daycare centers, they serve these dual roles. They allow caregivers to work, and that's why parents love them so much often, or they allow them to watch TV as well, but that's usually not the main idea. So they allow them to work and have more time available for other activities. But also they're supposed to be there to stimulate kids and feed kids and help their development. And so many governments around the world love these, and they're very popular programs but they're too expensive. So and even I work quite a bit in poor countries. They love to do that, but they can't. So it's really important to understand what they do in practice. What are their impacts on kids and on parents, on just not parents, just caregivers in general. And so today I'm going to talk about the value of having access to freely provided daycare. And I'm going to focus on impacts on children and caregivers of providing public daycare services in Rio de Janeiro, in the municipality. So Rio de Janeiro is one of the biggest cities in Brazil. And daycare in Brazil is responsibility of a municipality. So that's why we focus at the municipality level. We work with the municipal government at the time. I'll tell you what exactly we did, but the people I worked with the municipal government too in 2008 to allocate daycare slots to kids using a lottery. Okay, so that's another advantage of working with a city. It's a big city, it's 8 million people. So this is really 2 papers today. So it's a really old project, actually. The first paper is with the first set of co-authors is going to focus on a lot about caregivers. There's going to be a bit of child development. And then the second paper is going to look at something slightly different, which is going to be child preferences. Yeah. Doing something wrong? Okay. So as I told you, there was a lottery. I'm gonna explain that a little better, but we'll study impact on some nutrition, cognitive, and behavioral outcomes 4 and 7 years after the lottery. So daycare, it's 0 to 3, so it's really at the beginning of the kid's life when they're more intense. After age 4, is in the Constitution of Brazil. It's supposed to have universal access to preschool, but I don't think that's implemented in practice. But anyway, before, the situation is more dire for these households. The population that's helped by public daycare, actually, it's quite poor. It's not super poor, but it's poor. A lot of it lives in the slums, in the favelas of Rio, but not all of it. But it's a big chunk of the population I will talk about. Okay, so we'll have some measure of child development 4 and 7 years after they enrolled in daycare. And then 9 years later, we have a survey with some child preference data and decision-making quality. So the type of preferences we collected data on was risk aversion, but and we also had a version of a marshmallow test we applied in the households. I'll tell you a little bit in a few slides. And but we also have aversion to inequality. So how much kids dislike inequality and being on top and at the bottom of the whatever income distribution. In this case, not going to be income distribution, but allocation of toys distribution. And then we'll also look at decision-making quality, where they make transitive choices, for example, and so on. And then when we look at caregivers, we'll have some data on household work and income, but also other dimensions of what they do at home. And I don't have time to talk about all of them today. Many of them turned out not to be that interesting, but we have all the household members in each household. So we have, and many of these households have extended, they live with grandparents or uncles and so on. So the concept of caregiver is much wider than just the parent or just the mother. It could be the grandmother, could be multiple caregivers and so on. So it's interesting to see what happens to all sort of working age adults in the household. Okay, so as I hinted, there's going to be a lottery involved. So it's going to be an experimental study. Is not only in the slums of Rio, but it's primarily in the slums. The daycare centers, again, I told you this already, so I'm sorry I'm repeating myself. They're run by the municipality. One important thing, these are the public daycare centers that are there. They were there at the time. They are there now. This is not a new program. It's not a new intervention. It's not a new pilot study. This is a typical daycare provision in a middle-income country. Okay, so I also thought that was important to stress. So these are what governments can provide right now. So what does it do for mothers and for fathers and so on and for kids? Okay, so the only thing that we changed, well, we didn't change, but the municipality changed, convinced by this person here, Ricardo Paes de Barros, one of the super important economists in Latin America. Convinced by him, they changed the allocation mechanism at least for 1 year. So they decided to do a lottery to allocate slots to oversubscribed centers. Okay, and the reason they did it because they were allocating. They had a lot of the principals of these centers, the directors had a lot of discretion in allocating these slots. And then Ricardo showed the government that there was a lot of strange behavior involved. So they decided to do a lottery. So nowadays they don't have a lottery anymore, actually, because they call it a lottery. It completely means tested. So they do a lottery to get rid of small ties in the means testing index. But it's a much more transparent system now. Okay. So what do these daycare centers offer? So in Brazil, they're called creches. It's full day. So it's care. So it's, I forget, 8 hours or 9 hours a day. They have integrated services. So they have some health services. They provide a lot of food, at least 5 meals a day. Then, of course, they have the typical childcare activities. They have toys, materials, some stimulation, and so on. And they're not going to be as high quality as daycare centers in, say, in Europe or Northern Europe or in the US, for example, but they're not terrible. They told me at the time the average class size was 26, but it sounds wrong. But anyway, it's still in the slides because I couldn't find a good number. Maybe it's the average in Brazil. At the time, we started the study in 2008. Rio is much richer than the typical Brazilian city, so it's probably much lower there. What I found is in 2019, they actually wrote in the law, of course, enforcement and compliance with the law is not perfect, but it's supposed to be, the type of ratios almost that we see in Europe, for example. 6 kids per teacher for 0 to 2, 8 for 2 to 3, and 10 for 3 to 4. So what the point I want to make is these are not very different from the daycare centers most of you are used to. They're going to be a little bit lower quality. And then actually when they were observed, so you can classify these centers based on their infrastructure and the quality of interactions. Not the ones in Rio, I don't have a survey, but for a bigger survey in Brazil, they turned out worse quality than the centers in North America. That's the ones they were using as comparison group, but not dramatically lower. And when I ask my Brazilian colleagues, they say these centers are pretty good. Okay, of course they have different standards. I would probably not say that, but they don't find them that bad. They put their kids there. Okay, so how are we going to study? So this is going to be a simple paper. So today we're not going to have like complicated model. It's going to be just data and just 2 simple regressions. And so we'll have excess demand for childcare places in some areas and for some age groups. And in this year, 2008, they were allocated with a lottery. And so now typically you have 25,000 applicants in the city per year, where these daycare centers only have 10,000 slots. So there's big excess demand. Okay, so it's concentrated in some places, in some age groups. You have to be lucky. My kid is age 2. It turned out that, if it was age 1, he wouldn't have a slot, but age 2 he does. So you get the idea, right? So these lotteries will be specific to daycare center and age group. Okay, and we'll collect our own data afterwards. So we also have another paper with some administrative data, but I'm not going to talk about it today. So we collected our own data. And the lottery worked this way. So the households had 2 days to apply. There was some priority for special needs kids. So we had some obvious disability and so on. And the director of the center still had some discretion. It was only for 10% of the slots as opposed to all of them. Okay. But most of the slots are assigned through a lottery. Well, if there's an oversubscription. Okay, so the same thing. Okay, so in terms of the household survey, we gave 3 household surveys so far. So we intend to go to the field again eventually. And they are different. And actually, the samples are not exactly the same. But anyway, let me explain it quickly. So in the household survey, we have demographics, labor income, and of course, labor supply, employment, so on. We had some time use. I'm not going to show you data for this today because unfortunately, that data is quite noisy. It's not easy to collect time use data. Then we have some expenditure assets, childcare history. It was important to see when the kids actually attended daycare, at least the ones who got a lottery, how much non-compliance there was and so on. Home, environments, home is in capitals because there's a scale called a home scale. And then some maternal depression. So the sample is not exactly the same because of it. One reason is attrition, but attrition is not random, but it's not selectively random. So I'm not going to talk about it too much today, but there's a bunch of attrition. So it's kind of in 7 years, we lose almost half the sample. Now in 2012, which is our second survey, we not only lost some sample, we lost some money. So, I mean, we didn't actually lose it, but we didn't have money. So we collected data only on 60% of the universe. But anyway, it was random. Okay, our sample is still pretty big. And as I told you, lottery, as I told you, the attrition is not a big concern here. I mean, I can talk about it at length later, but we've done a lot of stuff. Okay. So in terms of child assessments, we have typical things like vocabulary tests. Again, it's different years. So 2008 was no child assessment. It was just a survey of caregivers. But 2012 and 2015, we had some child assessments, and 2017 is the child preference data. So child assessments, we have some cognitive stuff. We have some maternal reports on behavior of kids, and we have anthropometric. We have height and weight. Okay. Then we have the preference data I told you about, and I'll show you at the end. That's going to be the paper number 2. So you have an idea of how the sample looks like. So I have some values here in Brazilian currency in reais. At the time, 1 real was about, so $1 was about 2 reais. Okay, so when you get to the monetary figures, you can divide them by 2, and you get them in US dollars in 2012. Sorry, I told you this paper was old, but yeah, I didn't update the inflation. Okay, so I mean, I have a column here for mothers, another one for households. I mean, this is just a few variables. Our data is very rich. Okay, so 68% of mothers have basic education. That's slightly less than high school. Almost all mothers, I mean, not almost, but most mothers are working. So 68% of the mothers are already working. And then they, at 26 hours a week, that's averaging, it's assigning zeros for the mothers who don't work. So if you want the hours for people who actually work, it's going to be close to 40 hours. Monthly wage income, it's 561 reais, but again, it's averaging the zero. So if you want the wage for people who actually work, it's going to be about 700. Of course, there's selection and so on, but so you have an idea, and so divide by 2, it's about $300, $400 a month. Okay. So if you look at household income, household size is not gigantic. It's 4.5. Monthly household income, about $550 a month. And so, and food expenditure is about, again, divide that number by 2, about $250 a month. Okay, so when about 57% of households have somebody has a bank account. So we have an idea of what sort of population I'm describing here. Okay, then the data is pretty balanced. Again, we have a bunch of variables. This is just a set of variables. So it's balanced on a gender. So there's a difference between kids who won the lottery and lost the lottery, and age and household per capita income. We got that actually from the registers from the lottery, and education of the kid, whether the kid was breastfed. So there's a little bit of imbalance in one variable or another, but typically they're pretty balanced. Okay. So the lottery is not going to predict perfectly attendance. I mean, you can attend daycare for up to 4 years. Anyway, it was never going to predict perfectly. So you can attend daycare for 0, 1, 2, 3, 4, or 0, 1, 2, or 3 or 4 years, okay? And even if you don't get the lottery ticket, you don't win it, it's possible to find your way into a daycare center. Either you apply next year, for example, or you apply multiple times. Some people applied, they changed the name actually, so the last name, or they changed the gender of the kid. But we cleaned the data up a little bit, so it's not so common, but it happened. Okay, but as in anything we do, compliance is not perfect. So we'll also use the lottery as an IV. Okay. Okay. So this is how lottery affects daycare attendance. So we have here is the proportion of kids in our sample and actually, if we look at admin data, it's not going to be so different. So if we merge the admin data, there's also a problem with that data with the full lottery records. So it's much bigger sample, much bigger universe than our sample. Because we have a subsample of the universe of people participating in the lottery, for budget reasons, obviously. Still big. So it's supposed to be 4,000 kids. Of course, then we have some attrition. But you can go to daycare for 0, 1, 2, 3, or 4 years, and these are the proportions going for each amount of years. After they finish daycare, after they're older than 4. And so we have 2 bars. Control means you didn't get the lottery, you didn't win the lottery in 2008, and treatment means that you won the lottery. Okay, so you see, there's a discernible difference between the 2 groups. People who didn't get the lottery are much more likely to never enroll in daycare, so get 0 years of daycare attendance. But it's still only about 20% get 0, which means that even if you didn't win the lottery that year, 80% of them make their way into daycare, at least for 1 year. Okay, some of them make their way into daycare for 4 years. So they were able to get into daycare, into public daycare, even though they lost the lottery that year. Okay, but if you won the lottery, it's much more likely you take up daycare and you take it for much longer. So if you won the lottery, on average, you get 6 months more of daycare. So, it sounds low, but it's not, because on average, the typical attendance is 2 years. So it's basically increasing attendance in daycare for 25%. Okay, so that's kind of the intensity of our treatment. And the outside option is basically you stay home or you have some informal care. Okay, the private option is very low for these households because they're poor. And so it's mostly family. So it's either the mother, the father, the grandparents, and so on. Okay, so to summarize the data, I told you I have a lot of outcomes, a lot of measures of kids' development, and all kinds of measures of labor market outcomes and household wealth and so on. So to start with, I'm going to summarize them in a few indices. So we'll have an index of labor market attachment and outcomes. So it includes income and employment for all adult household members. Then we have some index of income and assets. And then we have some anthropometrics, so height and weight of kids. There is some cognition and some home environment data. And then I'll just do some intent to treat regression, so regress outcomes on whether you won or lost the lottery. I have some almost no control, just age and gender of the kid. But we didn't even have to do it. But then we put center by age group fixed effects, just because that's the strata where the lottery takes place. And then we have some IV. And so, of course, there you can debate what should be your endogenous variable. So we use years in daycare, but maybe that's not appropriate. And we have a model that's linear in years in daycare. So we interpret our estimate as what's the impact of 1 extra year in daycare, okay, on your outcome of interest. Okay, so these are kind of my intent to treat results. So for 2008, there's no child data, okay, so that's what's missing there, okay. But 2008, this survey was run 6 months after the lottery. So, I mean, all the kids who won the lottery were in daycare. And actually, if you look at compliance that year, if you won the lottery, the chances that you are in daycare 6 months later, it was above 95%. So if you won the lottery, you were almost all the kids were in daycare. Actually, they took it up. It just half the kids who didn't win the lottery also had access to daycare, even in that first year, okay? Anyway, this is intent to treat. So even that first year, even with a lot of contamination, those who won the lottery, so all the indices are standardized to have mean zero standard deviation one, and so they had higher labor market employment income, and then they were more likely to be employed. So they have higher labor market index. They have higher assets. They have better home environments. In this case, the home environment variables change a little bit over time. This is actually less maternal depression. Now, in 2012, the labor market incomes, the labor market impacts are a little lower, at least intent to treat. The income and assets are not much lower. It gets kind of mysterious, so they persisted. And the one reason for the labor market impacts to be lower is because the kids, almost no kid is in daycare in 2012. It's 4 years after the lottery, so everybody supposedly has access to free preschool by that time, okay? And then by 2015, the labor market impacts are even lower, okay? So I don't think that's surprising, okay? Because the winning the lottery was not there to, is not helping anymore in terms of relieving any time constraint. There could be persistent effects because somebody had access to the labor market later on. Maybe they got some labor force attachment and so on going on, but it doesn't seem to be super persistent, okay? Now, in terms of anthropometrics, we see big gains. So in height and weight, kids are, and very often in these studies of daycare, this is not measured. So we thought that was pretty interesting. So people focus a lot on cognitive outcomes, but unfortunately, very often they are measured, and very often we find zeros. And so that's also kind of true in our study. So we find some short-run impacts in 2012 and some, almost nothing, it's really a zero in 2015, but that's not uncommon in studies that look at the provision of daycare, and test scores, at least at these ages. But we find big effects on anthropometrics, so in their health. And as I told you, it turns out that kids are eating much better. They're probably eating much better in the daycare center. They could be also eating better at the home because the households are wealthier, at least for a while. Okay, and these are our IVs. So these are the impacts per year of daycare attendance. So if you look at 2008, so 1 extra year of daycare attendance improves labor market outcomes by 0.15 of a standard deviation. And the big impacts are really on anthropometrics. So for example, in 2012, 1 extra year of daycare attendance improves the height index, for example, by 20% of a standard deviation. So if you can scale this up and down as you want. This is 1 year. Childcare is 4 years. So you can compare 4 versus 0, assuming the effect was linear. So, but anyway, 4 versus 0 will actually be gigantic effect, be almost 90% of a standard deviation. So these are the sort of estimates we have. It fades out a little bit by 2015, but that figure is still pretty big, okay? Okay, so these are the results. I don't have to repeat my table. So I think one interesting thing now is to see what's inside. I mean, it's interesting to see what's inside some of these indices. So that's what I want to do next. Okay, I think that's some of the most important results are are these ones. Okay, so these are impacts on labor market outcomes of all adults in the household. I mean, here I just have grandparents, and siblings. There are also uncles, and there are others, which is, I don't know what others are exactly, but there's a category for others. I should know. I forgot. It's old project. But as I told you, most parents are working. I mean, fathers are working a lot. And then even mothers, I told you already, almost 70% of the mothers are working already, okay? And so we see a little bit of an impact in 2012 on parental income. By 2015, it's much lower, and it's not significant. And if you look at currently employed, it's basically zero. There's no impact of winning the lottery on being employed, okay? Now, if you look at grandparents, and this is going to be mainly the grandmother, but the grandparents who are in the household. If the grandparents are not in the household, we don't survey them, okay? But there are several households, I think it's going to be 1 in 5. They have one grandparent living with nuclear family. And so for the grandparents in 2012, we see a big impact on their earnings and a big impact on their employment. So this, and then again, this is intent to treat. Okay, so we can scale this up. So if you won the lottery, in 2012, the grandparent was 20% more likely to be employed, and this is off a basis of 50%. Okay, so this was a really large impact. So basically, you have one more adult working in the household. We also have some impact on older siblings. So to be in this data, to be in this table, you have to be 16 or above, and older siblings also in 2012 had some impacts, saw some impacts on their earnings and on their employment. And so by 2015, this is not as strong anymore. But again, as I told you, that's not so surprising because by 2015, for sure, everybody is in school already. This is 7 years after the lottery. Even the younger kid should be in 2nd grade. Okay. So there's no doubt you have universal access to daycare, public school, and then public school enrollment is very high in Brazil. Other measures of labor market performance are weekly hours, and contribution of Social Security means that they have a formal job. And then again, for parents, we don't see anything. But for grandparents and older siblings, and especially for grandparents, we see that they work many more hours a week, and they're much more likely to be formal employees. Sorry. So there's an impact on the labor market performance of caregivers, but it's not the parents. It's the grandparents, the siblings. So I thought that was pretty interesting, and it's not small. As I told you, it's basically one more adult working in the household. So it makes a big difference, at least for a few years. So you can see how that impacts household income then. This is the next table. So we see then, therefore, households are richer. And again, it's not because parents are making more money, mainly because of grandparents and a little bit of siblings. They eat more, so they have higher food expenditures, or at least they eat better food or more expensive food. They have more assets. The asset index is basically they have a refrigerator, a TV, motorcycle, telephone. You don't have a dirt floor. I mean, typical asset questionnaire given in developing countries. More likely to get access to a bank account, so interactions with the financial system. So it also gives you access to credit, of course. Oh, that's the next question, the next item. So we don't see so much there, but they have, at least they have a bank account. Okay. So in terms of home environments, we don't see that much. So this index I don't like so much because in different years is very different. But in 2008 is mainly decreasing. It's not maternal depression, it's maternal stress. In the other years, there's not much. So, okay. Now, this is the other big set of impacts for the first paper. It's on height and weight. So I gave you a big index before, but here we have height and weight separated. And we have impacts in 2012 and 2015. So this variable is the WHO Z-score. I mean, that's some norm to some representative kid, probably in Western Europe, but I forget where. It's to be mean 0 and standard deviation 1. That would be the representative one. And actually, Brazilian kids are not small. As you can see from the control group mean, they're pretty big, which I was surprised. But then I confirmed this. There's a paper in some PE teachers, so physical education teachers, who, I don't know why in Brazil, they weigh and measure their kids. They wrote a big paper with admin data, and they show that Brazilian kids are big. Okay, but that was reassuring. I thought there was something wrong with my data, but it's not. Okay, but the impacts, which is the ones that are in circle, are quite big. So height for age in 2012 is 16% over standard deviation, and that's big for a nutrition intervention. That's not a small thing. And this was not even a nutrition intervention. This was just providing daycare. It just turned out they gave them a lot of good food. And actually, one of my co-authors, to check this, they went to the daycare and they ate the food. And they told me it was pretty good. So, but it's nutritious, it's frequent, and it's good quality. That's the point. So the kids are bigger, but they're not overweight. And so you can see, I mean, this is just, in terms of, I mean, some people ask sometimes to see some densities. It's not mainly at the bottom. There's not a lot of stunting. Stunting means that you are below -2. So that's what we call usually stunting. And you see there's very few kids below -2. And then you have 2 lines. So the winners are the solid line. The losers are the dashed line. You have height on the left, on my left. Wait. Oh, this is both height, 2012 and 2015. And you see the impacts are kind of in the middle, in the top, not really so strong. I mean, it's not just the bottom, okay? Okay, these are impacts on, sorry, I think this is important. The kids are much healthier. And so even if I told you, we're not going to see too much on their cognition. This is going to be important for their lives later on, for their schooling and for their labor market performance, okay? So in terms of tests, I mean, we gave them good tests. So, I mean, they're supposed to be good data, but we didn't find much. We found a little bit in 2012, which, in the short run, and it's driven by the vocabulary test. It's the standard Peabody picture vocabulary test, the test of receptive vocabulary. But then in 2015, we gave them a really fancy IQ score. I was optimistic after we found the 2012 impacts. I splurged. I spent all my money collecting the IQ data. But then, I mean, it was a big headache. But we didn't find much. It is what it is. So we use the IQ data in an interesting way later. So it was not terrible. But we found impact on one dimension of this IQ test, but I'm not emphasizing it. Okay. And in terms of child behavior, we don't find anything. Okay. I know some papers find negative impacts. We didn't find that. Okay, I'm not going to summarize because it's kind of okay. So let me talk about preferences, preference formation and decision-making quality. So that's the 2017 survey. So that's 9 years after daycare. So kids are between 9 and 13, because in 2008 they're between 0 and 4. So we look at these preferences and decision-making quality for some kids at the start of adolescence. So they're beginning to make important decisions and so on. And there's a lot of behavioral economics is really about decision-making quality and then preferences and biases and so on. So we thought it was important to collect this data on kids. And so it's interesting data on its own. It's not so standard, and it allows us to see if daycare affects any of these measures. Okay. So in terms of preferences, we have some risk aversion. So that's standard choice between riskless and risky option. And these were all incentivized. So kids had some toys, or they had some tokens they could exchange for toys. Okay, so there were their answers actually had consequences for them. The toys were a ball, doll. There was something else. Oh, there was a Rubik's Cube. And there were a bunch of toys they could exchange their tokens for toys. Then we had sharing task to measure inequality aversion. So I'll tell you exactly what it is, but basically you play a game against an anonymous person, and then you have to split either toys. For example, you have to split 6 toys, and then you have some equal allocations and some unequal allocations, and you have to choose between them. Okay, so I'll give you an example in a second. And so we'll distinguish advantageous, disadvantageous inequality, which is advantageous inequality means it's inequality, but when I'm at the top, because it could be difference. I may not care about inequality if I'm at the top, but I may really care about inequality if I'm at the bottom. Okay, so that would be disadvantageous inequality. And as I told you, the beginning we gave a version of the marshmallow test. Probably everybody knows marshmallow test. So it measures delayed gratification. So we didn't give them marshmallow because the Brazilian kids don't care about marshmallows. Most people don't care about marshmallows. but Brazilian kids, they don't care about marshmallows, and they care about something that's better. So we gave them something that was better than a marshmallow. So we put the tent inside the house with the tablet and with the candy that they liked, and then they had to be, but like a standard marshmallow test, but applied, in the slums, in the houses. And then we had some decision-making quality that we used the same tasks to see if they have transitive preferences, and then if they make consistent choices. For example, if they make consistent choices in the risk tasks and the sharing tasks, okay? Or if they choose dominated alternatives, for example, that would be another measure of decision-making quality, okay? So it's going to be a lab in the field experiment. So I saw a little bit of this also this morning. And I told you this, okay? Okay, this is, I just wanted to, because maybe this one was not so standard for you, so just want to explain a little bit what is this inequality aversion measure. We have 10 trials. These are just four examples of the trials we gave to kids where they had to decide allocations. And so for example, take costless DI trial. DI stands for disadvantageous inequality, okay? And so in this trial, the child had to choose between what we call equitable allocation or other allocation. So if they chose equitable allocation, they get 3 toys, and the anonymous player they're playing with, they get 3 toys too. Or they could choose this other allocation where they still get 3 toys, but the other person gets 6. So supposedly they have the same amount of toys, so they should be indifferent. But if they really care about being at the bottom, they're going to choose the equitable allocation over the unequitable allocation, even though in terms of toys, it's not costly to them. Okay, so that's the idea. So that's the costless DI trial. Then we have the costly DI trial. Okay, the costly is it's more extreme. So you actually willing to pay to be equal or not to be at the bottom. Okay, so in the equitable allocation, you get 3 toys, but if you're willing to tolerate some inequality in being at the bottom, you can actually get 4 toys. Okay, so and then the kids could decide which one they care about. Then we did the same thing, but for being at the top. Okay, the costless being at the top trial, AI advantageous inequality trial, or the costly. Okay, so we have these sort of trials. Then we have some other 6 trials where this is not as obvious. Okay. Okay. So we use these trials and the risk preference trials and so on, and the marshmallow test, and we have some measures of risk tolerance, aversion to inequality at the top, at the bottom, being at the top, at the bottom, and delayed gratification. So one thing, since I spent so much money collecting the IQ data, so let's do something with it. So we correlated these preferences with IQ, and actually. Kids with high IQ, they're less risk tolerant, and they're more averse to inequality, and they're more likely to delay gratification. So they're more likely to wait for the second marshmallow. The other correlation we did was between the different preferences. And this is reported at the bottom of the table. So the idea would be, okay, are people more risk tolerant, also more averse to inequality or less averse to inequality and so on? The correlations are almost all zero. So those seem to be orthogonal preference traits. This is decision-making quality. So how many times you violate transitivity in risk task. The toys task is with simple task. Do you like a ball, a Rubik's Cube, or a doll? Okay, so which one you rank first? Okay, so it was just preference ordering. And then, but even in those cases, and some kids were 13 already, they violated transitivity. Okay, and so kids who violate transitivity have lower IQ. Okay, and in the toys task, in the risk task, and in the sharing task. Okay, and as I told you, some choices in the risk task were clearly dominated. So you could be super risk loving, but we call them dominated choices. And kids who chose dominated choices, they also have lower IQ. And these decision-making quality measures were all correlated amongst themselves. So that made us reassured that that was not just noise, because it correlates with IQ. And then kids who violate transitivity in one dimension, they also violate transitivity in other dimensions. Okay, so we thought this data was interesting. So then we tried to measure, does Daycare have any impact on these either decision-making quality or preferences? And the answer is, for most of them, not really, okay? And the one exception is inequality aversion. Of course, we don't have many. I mean, we only had like these 8 measures, okay? But the impacts were close to zero. I mean, it's just not, the standard error is not gigantic, okay? But there were some impacts on aversion to inequality, and especially aversion to being at the bottom. Okay? And the most interesting thing about it was it's all driven by girls. So boys, there was no impact on boys, but it was driven by girls. So this is not the same index, but I wanted to make it more obvious. But if I presented the same index as I have in the table in this figure, I'd find the same thing. So this is the number of times that either a boy or a girl preferred the equitable allocation versus being at the bottom, okay? And this is a mixture of the costless or the costly, okay? And then this is an impact on that. And girls who were more exposed to daycare, they were less likely to be willing to be at the bottom. Okay, and I mean that's important because Brazil. I didn't tell you the context, so I don't know how many of you know Brazilian people, but it's a culture, especially in these slums where women are the weak gender. There's still a lot of male dominance. There's violence and so on. So they call it machismo. We probably have a similar word in Italian and many other languages, but it's very prevalent in this culture. So, we don't have a good explanation of what happened. My idea is maybe girls were exposed to boys and they were socialized more in daycare and they perceived they were not inferior and then they're less willing to be at the bottom in general, okay? So we also have a little model to try to estimate willingness to pay for disadvantageous inequality. And so girls are willing to pay more, okay, after they attend daycare. Girls who attend daycare more for more years are willing to pay not to be at the bottom. So remember those costless DI trials. So we measure. So this 0.1 means that you're willing to pay 10% of the toy to reduce the gap between you and the other person by one toy. Okay, so I should have this in dollars. I asked my co-authors to translate this into something that it's more amenable, but we don't have a good one measure yet. Okay. So I'm almost done. So we didn't find and these are long run impacts. I mean, I don't know if you call 9 years impacts long runs, but almost a 9-year impacts are kind of pretty long run in the stuff I do. So these are not immediate impacts. we didn't find for most of the decision-making quality and preference formation data, we didn't find big impacts, but we found one exception, which is inequality aversion. It's driven by girls. So, I mean, I also thought that was interesting, and it could be related to competitive behaviors and all the things we discussed so far. Okay. So to summarize, so we look at impact of providing daycare for free in a middle-income country, in targeting poor households on children and caregivers. And we used this lottery that took place at the end of 2007, but that was for enrollment in 2008. And we have imperfect compliance and so on to get some good data on caregivers and kids. And we saw, I think the most interesting things we saw was increase in labor supply of income and income of caregivers, but it was not the parents. I know a lot of times the discussion is the mother's labor supply. It was not the parents, it was the grandmother, and it was the sibling, older sibling. I didn't check, it was older sister, but it's older sibling. And that led to a big increase in household income. For a few years, we have basically one extra adult working in the household. We didn't see much on child cognition, that's not unusual. But we see big improvements in their nutrition, so in their health, and those are really sustained. So we collect the last set of data we collected was 2015, but that's already 7 years after the lottery, and no kid is in daycare anymore. And these effects on, at least on height, I mean, they're not going to go away because you're not going to, I mean, in principle, right? So if you affected height at the beginning of your life, those are going to be pretty sustained. So that's why it's so important and so significant. Okay, so I think it's really good indicator that they're much healthier. And the other interesting thing we found, I think, was that there was a change in the aversion to inequality, especially aversion to being at the bottom and driven by girls. Okay, so that's it. Thank you so much. Yeah. Questions after this amazing presentation? Yeah, okay.
Thank you, Pedro. Super cool. I was just wondering if you could discuss a little bit, how to relate your results with the results of other papers in literature. The impression that other papers for different countries tend to find small or no effects of childcare attendance on child development, including health. Even negative effects for some groups. So I guess one thing is, why do you think that in your setting, the effects were more positive than in other countries or settings? And the second one, I guess, is do you find any evidence of heterogeneous effects in the direction of perhaps, depending on the characteristics of the parent or the counterfactual or, household income or maternal education, the types of variables that other studies suggest may lead to positive versus negative effects?
Oh, okay. These are really good questions. So in terms of, I don't know, maybe the Brazilian centers, I mean, this population was quite poor, and maybe they just gave them a lot of much better food, nutrition. And these are where we really find the big impacts. I mean, the results, our results on cognition are not so different. And the results on behavior, they're not negative across the board. Okay, so I don't think our study is so different in that regard. I don't know if the results on health are, I have not seen many studies focusing on the health of kids. And here we found a big impact, but I think it's basically driven by better nutrition, right? So we did heterogeneity. We didn't find anything very obvious. There's something related with girls. So the impacts, actually everything I reported is bigger for girls. I didn't emphasize it because it's not statistically different. But the impacts are bigger for girls. The impacts on health are bigger for girls. The impacts on cognition are bigger, and when we see them, are bigger for girls. But the we didn't see anything different by household income or parental education. Although this population is not it's kind of poor, right? So it's not, I mean, there's some variation, but it's not representative of the population in Brazil. Yeah.
Pedro, thank you for the talk. I'm trying to understand the assignment, the random assignment. As I understand it, you have to have applied for a place in the daycare. Did you have any way to test the composition of the people in the household of the people who didn't apply or think about? So I have a particular idea in mind, and that is if you've got an older sister, your parents aren't as likely to even apply to get a place for you in the daycare.
Right.
And so I wonder how you would interpret your results if you think about that kind of selection, that the set of people who actually applied and were part of the lottery have a different distribution than if you randomly drew somebody from the set of people who have children 0 to 3.
Yeah, that's a good question. We can't do it. I mean, there's not good data.
But do you have a sense from like census data or anything like that?
No, I mean, I will, now that you asked this, I will try to find out, but I have no idea. I mean, I asked a little bit. We have 25,000 kids applying every year, so I don't think that's not very selective. So I think the proportion, the set of people not applying is going to be small, and so they're probably the ones who have better informal options, which is what you're hinting at. Yeah. So, but I will ask them at the very least to tell me what proportion 25,000 is of a given cohort. Yeah, that's a good question.
Hi, Pedro. Thank you so much for your very entertaining and insightful presentation. My question is with respect to the returns to such an intervention. So the employment effects are really interesting for boosting employment and incomes of grandparents and siblings, you said. So A, is that in the former sector, are they paying taxes? B, if that is so, what would be the return of this intervention or the dollars returned for the cost of the intervention? And could you make an argument for saying, why won't we make this universal?
Yeah, that's a good question. So I don't have my slides up anymore, but I don't need them. So there is an increase in the formality. So there's grandparents who get access, whose grandkids get access to daycare. They're more likely to get informal. So they're more likely to pay our measure is actually paying Social Security contributions. And so the effect was big, okay, but it's not very long lasting. So if we compute cost benefit just based on that, it's not, I mean, these centers are super expensive. So unless it's all fixed costs, which is not, I don't think it's going to pay for it. But, I think if you factor in the health of the kids in the long run, so I want to collect data to see if I have some longer outcomes. It may be that these centers are kind of really cost effective. Now I don't know yet, but not just based on the labor supply results. I don't think that justifies it. Yeah. Yeah. Oh yeah, that's a good. Yeah, we looked. Yeah, so sorry. That's actually I should have said that, but then you would not have the opportunity to ask this question. No, I forget this. We did check. So there's no impact of the lottery. Oh well, there's two ways to interpret your question. One is, actually we don't know. One is the households that have the grandparent are different, and so that we just have heterogeneous. And we have impact on grandparents. And so it may be that the households are just different, but there's no impact of the lottery on whether you live with the grandparent. Okay, that's kind of at least at that level. But it's true, these households can have other unobserved attributes, I don't know, that are correlated with grandparent work, although, I mean, it's hard for me to, imagine the whole thing, yeah.
Do you see any spillover effects on the children under 5, perhaps, who didn't win the lottery in the households where there are other, the brothers and sisters won the lottery?
Yeah, that's a good question, but the answer is simple. Yeah, we didn't collect data, so oh, yeah, sorry.
Thank you very much.
Thank you. Very exciting General Assembly.